Okay, so we're about to dive into one of the absolute strangest puzzles in all of neurology, Gerstmann syndrome. It's this really rare condition that shows you just how specific, how interconnected, and honestly how weirdly organized our brain's abilities really are. Just for a second, imagine this. You wake up one day and the world just feels off. You look down at your hand, a hand you've seen your whole life, and you can't name the fingers. Someone says, "Turn left," and the words mean nothing. This isn't science fiction, you know. It's the incredibly disorienting reality for someone with Gerstmann syndrome. So where did this even come from? Well, you have to go all the way back to 1924. There was an Austrian neurologist, Josef Gerstmann, and he had a patient with this super specific cluster of problems that just didn't fit any diagnosis he knew. It took him a while, but by 1940, he published his findings, and the medical world started to recognize this rare but very real condition.
And the real key to understanding Gerstmann syndrome, it all boils down to the number 4. The condition is defined by what's called a tetrad. That's a group of exactly 4 core symptoms that, for some reason, almost always show up together.
And here they are. These are the 4 pillars of Gerstmann syndrome: finger agnosia, right-left disorientation, agraphia, and achylia. Now, I know they sound complicated, but they actually represent fundamental skills that we all use every single day. So let's break each one down. First up, we've got finger agnosia. The name itself is a pretty big clue, right? Agnosia comes from Greek for without knowledge. So it's basically a loss of the ability to recognize something pretty fundamental. Now, this isn't about being unable to use your fingers. The muscles work fine. It's a disconnect in your brain. A patient literally can't name their fingers or point to a specific one when asked. And what's really fascinating is that the problem is often worst for the 3 middle fingers. You know, the index, middle, and ring fingers. So strange. All right, next up is a symptom that would make just getting around town incredibly difficult. We're talking about a complete and total confusion of right and left. And this goes way beyond just mixing them up every now and then, like we all do. It's this profound disorientation. A classic test for this is really simple but tells you everything. You ask a patient to touch their right knee with their left hand. Someone with this symptom might use their right hand or touch their left knee instead. It's like their internal GPS has just completely crashed. The third piece of this very strange puzzle is agraphia. This one attacks our ability to communicate in a very specific way. And the really crucial point here is that this is a loss of an ability they used to have. Think about it. A person who was perfectly able to write, who could write letters and sign their name, suddenly can't form the letters or words to write down their thoughts. That connection between their brain, their hand, and language, it's just gone when they try to put it on the page. And finally, we get to the 4th symptom of the tetrad, acalculia. If you think calculator, you're on exactly the right track.
Yeah, this is the loss of the ability to do math. And we're not just talking about complex algebra here. We're talking about the absolute basics, simple addition, subtraction, the kind of mental math you do without even thinking when you're figuring out a tip or checking your change. For these patients, that ability can just, poof, vanish.
Okay, so let's pause for a second. We have these 4 symptoms that seem totally unrelated, right? Fingers, directions, writing, and math. What do they have in common? The big question is, what single part of the brain could possibly be responsible for all 4 of these things?
Well, Gerstmann himself actually figured it out. It all traces back to damage, or a lesion, in a very specific spot in the brain's parietal lobe. The exact spot is called the angular gyrus, and you can think of it like a critical intersection or a hub where the neural pathways for these 4 distinct skills just happen to cross.
So what causes the damage to this little spot? Well, most often, it's a stroke in that area. But it can also be caused by things like brain tumors, a really serious head injury, or a subdural hematoma, which is bleeding on the brain. Basically, anything that damages this one critical intersection can flip the switch and trigger the syndrome.
But of course, the puzzle has another layer. This isn't just something that happens to adults after an injury. Gerstmann's can also be developmental. That means some children are either born with or they develop these challenges as their brains are still forming.
Now, when you hear about symptoms like trouble writing and calculating, you might be thinking, well, isn't that just a form of dementia? It's a fair question, but it's not. And doctors have a pretty clear way of telling the difference.
The distinction is actually super clear when you look at them side by side. Dementia involves this broad, widespread cognitive decline. But Gerstmann's is almost surgically precise. It's just that specific group of 4 symptoms.
And a huge difference is memory. Patients with Gertsmann's generally keep their short-term memory, which, as we know, is a key thing to go in conditions like Alzheimer's. There's also less general confusion, and the onset is often sudden, like from a stroke, not the slow, gradual decline you see with dementia.
So once a diagnosis is confirmed, what's next? What does the path to managing these really challenging symptoms actually look like?
The approach is really twofold. First, doctors try to treat the underlying cause if they can, managing the effects of a stroke or maybe addressing a tumor. Then, at the same time, patients can work with therapists, usually speech therapists, to develop new strategies to cope and to work on regaining some of those lost functions.
And that really brings us back to the central mystery of it all, doesn't it? It's just a testament to the incredible and sometimes just baffling efficiency of our brains. How can one tiny little patch of brain tissue be the master hub for four skills that feel so completely disconnected from each other? What does that tell us about how our own minds are wired? It's a puzzle that reminds us that the 3-pound universe we carry around in our heads is still full of so many secrets,